Leaves of 3, leave it be. A fun little saying that warns us away from Toxicodendron radicans, better known as poison ivy. It is a poisonous North American plant that can cause an itching, irritated, and sometimes painful rash when it comes in contact with bare skin.
Poison ivy is a form of dermatitis which is caused by exposure to the poison ivy plant. What happens is the fibers from the plant rub up against the skin and cause an inflammatory reaction, which usually occurs anywhere from 2 days to a week later. That's why it always seems like it is spreading. Now, during the time where the antigen or the fibers from the plant are on there, it can be spread from person to person, but once the rash usually appears, it is usually not contagious.
The rash is an allergic reaction to a clear liquid compound called urushiol. The poison ivy plant produces this compound in its sap. The sap sometimes leaks onto the surface of the plant. When an unsuspecting person brushes past the plant, the urushiol binds to the skin on contact. This causes an immune response, and the body sends white blood cells to the area where they consume the foreign urushiol. This also damages normal tissues, resulting in the characteristic rash.
Poison ivy looks like any other type of contact dermatitis, but it does have a classic weepy appearance to it. But it's pretty easy to diagnose, and it's also, the patient usually gives you a history of having cleaned some brush in the woods, and usually education is very helpful in the treatment of poison ivy and preventing recurrences and recognizing what the poison ivy plant looks like.
Besides having 3 almond-shaped leaves, poison ivy has a number of other identifying characteristics. The leaves have a smooth surface with no or few teeth around the edge. Each group of the 3 leaflets grows on its own stem, which then connects to a vine. The middle leaflet usually has a visibly longer stem. The vine does not have thorns, but is often hairy or furry. Around 15 to 30% of people don't have any allergic reaction to the plant, but for others, it can lead to an exaggerated allergic reaction called anaphylaxis.
Sometimes people actually develop an allergic type reaction where their tongue swells, their throat begins to close, and those people should probably be treated with some type of desensitization through an allergist to do that, and that can be dangerous.
If you brush against poison ivy, you can potentially prevent a reaction by immediately washing with soap and water or rubbing alcohol. However, most people out in the woods don't have access to a washing station. If a rash appears before you can wash off the urushiol, don't scratch it, as that can spread the urushiol and widen the rash. When you return home, you may need to turn to your primary care doctor for treatment.
The treatment for it can either be cortisone cream, which you often have to use quite a bit of, but the better treatment often is oral medications such as prednisone or corticosteroids, because, like I said before, the rash could come out even up to a week after exposure, so that will prevent further rashes from forming.
Urushiol can remain active for several years, so you should be careful handling even dead leaves and vines, as the urushiol may still be on the surface of the dead plant. Wear protective clothing while gardening or hiking, such as gloves, long sleeves, and pants. This will protect the skin. When hiking, stay on cleared pathways. Be sure to thoroughly wash clothing, tools, or other objects that are exposed to poison ivy, as the urushiol can transfer to that surface and still cause a rash. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.